this debriefing time. Thanks for all your participation. And I want to have everybody just tell me briefly how you felt during the scenario. I know this is probably the first simulation you've done, some of you have done, but I kind of wanted, just before Aaliyah gives her comments, I kind of wanted to see how you felt. So who wants to go first? Anybody can go first.
I think it went pretty smoothly. I think we were a little bit nervous, but I think it went pretty well for our first time.
Okay.
I'm sure we can improve in some areas, but right now I'm not really sure where.
Okay.
In the beginning, I was very nervous when I walked in, and but once I got into it and I had the script and everything, I calmed down a lot, and then I just got into the role, I had fun learning. It was a fun time.
Casey.
I was nervous too, but I think it went all right, and I felt like we all did a pretty decent job.
And when you have tasks to do, does that help relax you a little
Yeah.
bit more?
Oh, yeah.
When you've got things to do, when you
You're
kind
not
of have an
really thinking.
idea
Yeah.
of what you might need to do? Okay. What about you, Mary?
Well, having been through simulations through your class before, I think this will really benefit future students. Because I think before I kind of felt at a loss, not knowing what to do, and I think this will kind of guide the future students.
Okay. How about you, Aaliyah? You've been in the simulation scenarios before too. Do you think seeing something like this ahead of time would help you feel a little bit more relaxed?
It'll let you know what your actual role is, because you tell us on day one and everything, but everyone's nervous, and when you actually get in there, you don't know, especially if you're the primary nurse and you're in charge of everyone and you've never been in charge of anyone else. It's really hard. So when you first do that, it's good. Throughout the program, we practiced, giving the SBAR report and everything, but when you actually have an SBAR report, you actually have to call on the phone and then talk to, an instructor. It actually makes it real, a lot more real. So I like that.
Okay. So, Aaliyah, do you want to go ahead and give your observation comments from your sheet that you filled out? And remember, everybody will have an opportunity to give observation, okay? Everyone will have a chance in class to be an observer. Everyone will have a chance to play every role, okay? So that there's a rotation among the role. And remember, the role of the observer is also to start off with positive comments, because that's what we need to focus on. What went well in that scenario? Not always what do we need to work on. Because many times we're hardest on ourselves. We know a lot of times, as students, what I need to work on, how I maybe didn't wash my hands, how maybe I didn't put the railing down on the bed so that I could access the patient. All those types of things. A lot of times, sitting back, you recognize some of your own things that you could have improved on. So go ahead, Aaliyah.
So starting with the positive, always. I think everyone did a great job when it came to washing your hands. You also asked the family about the allergies. When you even asked the patient, you clarified with getting more information with the family. You did very good with explaining what the O2 stat was and what the antibiotics were and what you were doing when you're doing certain procedures like the blood pressure and the temperature. You did a great report from the ED nurse. That was very good. You said all the vitals, the situation, what the oncoming nurse who's taking over the patient needs to know right in and there. And a little bit of their past history is really good too. You informed the family of the differences in the change in the patient's condition, such as when they became neutropenic and you knew that. You took the flowers out immediately. You explained to the family why certain things were happening, what kind of food they could have, which is really good. You were very quick to change your needs. Like when he said he needed a straw, you were very quick to just go get the straw instead of just try to choke him with the water. You had very good slow communication. Everyone, when you explained to him certain things, you were very good, slow, said it at an appropriate age level and communication level that he could understand. You were very good when you washed your hands in and out of the room. Wearing gloves when it was appropriate, like doing the IV or getting the sputum culture was very good. You also did very good when he had to prompt you a few times for the O2, but once you got that he couldn't breathe, you were very quick to grab the the nasal cannula for him. And the IV was very good. It was very, like, the procedure was nice, and you kept it clean, and you didn't cough over it, and, you know, do all that other crazy stuff people do nowadays.
Or have your hair.
Yeah, or have your hair, or just wipe it with your elbow or anything. You did very good with that. So I gave you guys a 3.5 out of 4 scale, 4 being the very best, 1 being very poor, and you guys were WCC, so you know how we did. Also, the readback was very good when you guys both called the doctor and everything. The readback was very good. It was the SBAR, and good job on that. Pat yourselves on the back. The only things I would say you need to work on are the body mechanics. Some of you may need to raise the bed a little bit more. Make sure that you're introducing yourselves right at the beginning, because the patient did start talking, but you didn't introduce everyone on the team, and you kind of had to prompt for certain people's names and everything. Otherwise, you did introduce yourselves, which is good. And then just the assessment on the patient. No one assessed the patient's lungs as soon as you got in there, because he said he couldn't breathe and his lungs were not assessed. And he does have pneumonia, but you didn't check for yourselves and everything. Listening to the heart or the stomach, those could also lead to other problems that he may have had. And then asking when he last ate, because you didn't know if he needed to go into a procedure or anything like that, or if he was a smoker or anything like that. So.
Okay,
Yep.
that's a good point.
Oh, and checking the ID patient. No one checked his ID.
Yeah.
So you gotta check them 2 ways.
That's good.
Especially.
Checking it 2
ways.
ways.
Yeah, he got meds and he got IV fluids and even just coming into the room and
So he
everything.
gave the verbal, but you didn't.
Yeah, you need to check the ID band and ask him for his date of birth or
Okay.
Full name, date of birth.
yeah. It helped that the wife was here, but if the wife wasn't here or if she was confused herself, then it would be a little hard. And you
But
did
still,
get
you should
yeah.
do that automatically, no
Yeah.
matter what the point is.
Right.
Okay.
otherwise it was really good.
Anything else did you recognize in your own roles that you played? Mary, did you document in the computer that you started the IV?
Yes.
And put in, okay,
Yes.
because that's something we always need to do, is that we put in the computer that we started the IV, the time, the date, the rate. How did you calculate the IV rate?
For the bolus, they wanted 500 milliliters into Mr. WCC within the hour. So you would take 500 and divide that by 60. So,
Okay.
Yeah.
Per minute.
For yes.
And then what type of tubing did you use?
10 milliliters.
10 drops per milliliter. So if you didn't have a calculator at hand, what could you use?
You could go to your smartphone
Okay,
and
a
ask
smartphone.
or you can go to the computer and
Uh-huh.
there's Google applications for that.
Okay,
Yeah.
Google applications on how to calculate the milliliters per hour or the drops per minute, right?
Mhm.
What about, because I noticed that you're giving temperatures in Celsius. How do you calibrate how to calculate between Celsius and Fahrenheit? How would you know to do that if you don't remember the formula?
Google it.
Yeah, Google it. But a lot of people also have cheat sheets. Like you can
Okay.
carry little pocket books that have the easy,
Okay.
you know.
Sometimes the
Conversion.
hospital will have the conversion for you.
Okay,
Sit in a room or.
okay. Or you Google a converter also, okay? What about medications? If you don't know about medications, what could you use for medications on the computer?
Call the
On the,
pharmacist.
Call the pharmacist
on the
or-
MAR. A
or
lot of
MAR.
the ones nowadays you can click on the MAR and then it'll show up a lot of information on it,
On the
just like it would
Okay.
in a drug book.
Right.
Okay. Where else could you use to get information on medication? Now, you could go to Micromedics
Yeah, yeah,
or
Micromedics.
Hippocrates. Many of the institutions, though, remember, have eliminated using
The
drug books
Oh, really?
because they recognize that those are not
Outdated.
updated. And so
The computer
meds, we
updated
know,
right
are
away.
updated every 3 to 6 months, you know. Changes occur, meds are eliminated by the FDA, so we know that a lot of times meds, so drug books really are no longer accepted in most healthcare institutions, right? They want you to use the up-to-date references that are available, such as Micromedics or Hippocrates.
Okay.
So pretty much any information, what if you didn't know about the pneumonia he had?
Oh, you just Google it.
Okay,
You can
what kind
find
of pneumonia do you
information.
think that maybe he had?
Um,
What do you think was going on with Mr. WCC?
HIV.
Yeah, I'd have to say he possibly had HIV.
Mm-hmm.
What gave you that indication, Mary?
His CD4 count.
Okay, his CD4 count was what? Do you remember?
No, I don't remember the top of my head.
It was
but-
189,
Yeah.
okay? So what should a CD4 count be to say that the patient's normal and healthy?
Below that.
No, it should be
Oh,
above 500, okay?
Oh.
So CD4 count should be above 500, okay? And how did you know that he was neutropenic? What was his lab level? Do you remember that?
WBC was 3,100.
WBC count was 3,100,
Yeah.
okay? What was his platelet count? Because you also said he,
65,000?
75,000?
65.
65? So what should it be?
Between
150 and
450,000.
So 400,000. So what do you know from that? What do you know that you should prevent when we have a low platelet count like that?
Bleeding.
Potentially could cause
and
bleeding, right?
Uh-huh.
You want to be careful of how many times you puncture, the veins.
Okay, so you probably wouldn't want to give them any intramuscular injections or sub-Q injections. What about if you had to give them like the low molecular weight heparin, like Lovenox?
You wouldn't want to do that because that would make him bleed
Bleed
more.
Potentially
Yeah.
bleed, but what would be the benefit versus the risk
Um,
of giving a low molecular weight heparin?
So he wouldn't have blood clots?
Correct, so he wouldn't develop blood clots.
On the bed
He's
for
laying flat, so
Bruises on his bum.
would you question that if there was an order like that for Lovenox injections, if the healthcare practitioner, or would you get that ordered for the patient?
I guess I would question it, just to, double check it to make
Okay.
sure.
What do you think about that? About using a low molecular weight
Well, if
heparin?
he's gonna be on bed rest for a
Okay.
long time, I would definitely suggest that to, if it's not already ordered,
Okay,
I would definitely mention that to the primary care
Okay.
doctor.
right, because we don't want him developing
Right.
blood clots.
He's not gonna be able to move if he can't breathe, and he's, so.
And we probably want to get SCDs ordered as well.
Right,
He's laying
SCDs,
bed.
right, definitely ordered for him. So there's a bunch of things that we need to do to have put on his legs, right? Compression devices on his legs to prevent DVT, because that's one of the initiatives of healthcare institutions, right? To decrease the,
Circulation.
decrease the risk for VTE, venous thromboembolism, right? Or DVT, so we want to do that. So that might have been in order to contact the physician with too, right? What else do you think? Do you think you should call infection control?
Oh, yes.
Why? What would be the reason that you might want to call infection control with
Prevent
his
further infections because, because of
And the
blood.
spread.
Yeah,
Okay.
spread.
Okay, but isn't standard precautions enough when we have an HIV patient?
Well, with the droplet precautions, if he's got pneumonia.
Pneumonia,
Okay,
sputum and all that coming out.
okay, possibly some type of, so maybe some contact precautions? Because who could cause an infection in him?
The wife.
The wife,
Mhm.
right?
Anyone entering his home.
Anyone enter his room, right? If they're not gowning, gloving,
Right.
possibly putting mask on. So remember, if they are sick, if they have a sore throat or fever, should they come into the room?
No,
No, okay.
no.
And we would teach that to the
But the
wife
precautions
too.
would tell them to come to the desk first, right, to find out.
Most of the time, it might have them come to the desk, or there might be a sign on the door, and then the nurse is going to have to make sure that they inform the family members or visitors or anything that they need to wash their hands and put gown and gloves on before they enter the room, and then take them off before they leave the room and wash their hands again, okay? Is there anything else that you want to talk about Mr. WCC and the scenario that we did today?
Yeah,
I thought, oh,
I'm sorry, he did mention that he didn't want to tell his wife about the affair. So, because we need to keep that, forgot the word for
Protect
it.
his rights, HIPAA.
Yeah, protect his rights. That would, you know, we should explain to him that would be up to him to tell her that we wouldn't play that role.
So if we're thinking he has HIV, which he might have, but we really don't know yet. We just
Right.
have a low CD4 count, and possibly the healthcare practitioner is going to have some further orders, some further tests on, like a RNA level, HIV RNA level, and see what his RNA level is. But what might you do if we have the wife there, the husband doesn't want her notified? What could you possibly get an order for?
An HIV test?
No, I mean, we wouldn't do that.
Okay.
What about a social work consult?
Oh, yeah.
What do you think about having a social worker come in that might be able to mediate, right? Because if he is actually HIV positive, what do you know in the state of Michigan?
He has to know anyway.
Yeah.
He has to
Yeah.
know, he
Yeah.
has to notify her
every partner.
as his partner, if they're gonna continue having sexual relations. So otherwise, it's considered a felony in the state of Michigan. So every state has individual orders, right, rules, guidelines that they have to follow. So, yeah, so maybe a social worker might be there to help mediate that situation and like maybe recommend some support groups, those types of things, once he's told his wife, if he chooses to tell his wife, okay?
Would you do that social worker, would you contact a social worker before you ask him about it? I mean,
I might, when he's by himself,
okay.
okay, ask him how he feels about a social work,
Okay.
right? To kind of,
Help
because,
me.
and you might have to explain the
Right.
law, okay? That if we do find out that he is indeed HIV positive, you might have to explain the law and say by law he has to, or have the social worker explain it to them.
And then that's the nurse's role, right? We can't explain to the patient what the
Correct,
law is.
what the law
Okay.
is, right, and that if he's gonna continue having sexual relations with his wife, then he needs to inform her, and that's her right to know,
Right.
okay? And that if not, then, you know, maybe we have a social worker in there to mediate. Anybody else have any other input?
I thought it was a good way of her shutting me down or trying to find out what was wrong. She did a good job, and you did a good job also when you said, I asked what was his vitals, and you said the nurse will talk with him about him, you know. So I think they did appropriate, they were appropriate.
Protecting the HIPAA rights?
Yeah.
Anybody else have any other input before we close on this debriefing? You guys, great job, team. This was an excellent first job. Yay!